Okay, so Jeff, I've heard of other appliances that they're not headgear, but they have the headgear effect, and we're wondering what you do in your practice to avoid the headgear effect.
In my office, we use a device called the ALF, Advanced Light Wire Functional. What it does is it's a small arch wire that fits on the roof of the mouth to gently develop the arch up top without impinging hard on the palate. The effect is that it will effectively open the airway. It drops the palatal vault, which means you open up the ability to breathe through the nose better. Increasing nasal patency is very, very important because then you produce more nitric oxide, which helps the body to heal. It's just a healthier way to go, is how we feel. We try to avoid appliances that would lock up and snare the maxilla or the upper jaw.
Okay. What about fixed width retainers? I've been reading about, or even just common sense tells you that fixed width retainer on a kid that isn't growing will stunt the lateral growth. Uh, what would you have to tell? What should parents know about that?
We really try to avoid the fixed retainers as best we can. This is why we like to start with children at an early age. In my own office, we're on a campaign to start with children, interview them at age 2 or 3, and plan for their future growth and jaw development. The real problem here is, Omar, that we live in a polluted world. Food has no more nutrition in it. Our jaws are just not growing and developing like they used to do 100 years ago. Not to mention, people are living to be about 100 years old. So we have to kind of develop what I call a 100-year plan. We really need to develop it on the little people, the young kids, and give mom and dad a pathway for the future.
Okay. What are some of the consequences of a fixed retainer when a kid is not finished growing?
Okay, for sure what will happen if you put a fixed retainer in, you're going to block the flow of cerebrospinal fluid, which is critical to the development of the upper jaw, especially. The CSF, or spinal fluid, pumps 7 to 14 times a minute through the skull, through the cranium. If you block that, you're blocking growth. Not to mention, the CSF also pumps out the interstitial fluid, which is the waste fluid, and so you could get a buildup of toxic waste in the cranium if you don't let that stuff pump out.
And then would the kid's face be narrower than the DNA wants it to be?
Yes, almost every time you're going to see a high roof of the mouth, a high palatal vault, which blocks nasal breathing. A lot of these kids come to see us, they have open mouths, their mouths are like that, they can't breathe, so they push their tongue forward. That's the tongue thrust that you see. And the bite is open like this, the front teeth don't close. They're just trying to open their airway and breathe.
Is that forward head posture?
Forward head posture, just like I tell our patients, it's like you're doing CPR, cardiopulmonary resuscitation, on your own self. By throwing your head forward, it opens up your airway.
Hmm. And I guess what are the postural issues that parents should know about?
Well, well, we tell our parents that when the ear canal is 1 inch ahead of the shoulder, excuse me, that's an extra 10 pounds of weight hanging on the neck. You will develop neck and back issues if you put a 10-pound weight hanging around your neck.
Okay, so the ears are supposed to be above the shoulder, and if you push the jaws back, then you can't sit like that because your airway's closed.
Yeah, just like all the kids we see these days, they're hunched over their laptops or their little phones. They're typing away like crazy, and they're hunched like this.
Yeah.
A very bad position long term.
Okay.